Bismillahirrahmanirrahim. I am Dr. Shajeea Javed, PGR Community Medicine, and I am going to present the topic of obesity under supervision of Professor Dr. Saira Afzal. Obesity. Obesity is a medical condition sometimes considered a disease in which excess body fat has been accumulated to such an extent that it can potentially have negative effects on health. How to diagnose obesity? The diagnosis of obesity is not simply made by just standing on a scale. Rather, it is identified by various factors that include BMI, skin fold thickness test, waist size, waist to hip comparisons, screening tests like ultrasound, CTs, and MRIs, certain tests to help us diagnose obesity-related health risks like blood tests to examine the cholesterol level, glucose level, LFTs, TFTs, or heart ECGs. BMI. BMI is a value which is derived from the mass and the height of a person with a formula BMI equals to weight in kgs over height in meters squared. Classification of obesity. Medical organizations tend to classify people as obese based upon their BMI. WHO classification of weight status shows that if a person has a BMI of less than 18.5, it is underweight. A BMI of 18.5 to 24.9 is considered in the normal range. 25 to 29.9 BMI is considered overweight, while the persons with a BMI greater than 30 are considered to be obese. Obesity is further classified into the three categories. Class 1 has BMI of 30 to 34.9. Class 2 has a BMI of 35 to 39.9, while the BMI of greater than 40 is considered to be Class 3 obesity. Although the BMI is typically used to assess the amount of the body fat in relation to the height, the weight circumference tends us to give abdominal or the central obesity. But the exact measurement of individual's body composition is given by the body fat percentage. The body fat percentage obesity chart shows us that the male and the female. In the essential category, the essential fat in the women are 10 to 13%. The men have less fat. They essentially have 2 to 5% of the total fat. On average, if the women have 25 to 31% of the fat, and the men on average have 18 to 24% of the fat. If the women have 32% of the fat or greater than it, they are considered to be obese. And if the men have fat greater than 25%, then they are considered to be obese. This guideline is according to the WHO.
Dr. Shajeea, please start your presentation from the first slide so that the recording would be available on our YouTube channel.
Yes, ma'am. Bismillahirrahmanirrahim. I'm Dr. Shajeea Javed, PGR Community Medicine, and I'm going to present the topic of obesity under supervision of Professor Dr. Saira Afzal. Obesity is a medical condition sometimes considered a disease in which excess body fat has been accumulated to such an extent that it can potentially have negative effects on health. How to diagnose obesity? Obesity is not diagnosed by just simply standing on a scale. Rather, it is identified by various factors that include BMI, skin fold thickness, waist size, waist to hip comparison, screening tests like ultrasound, CTs, and MRIs, and certain tests which help us to diagnose the obesity-related health risks like blood tests to examine the cholesterol level, glucose level, LFTs, TFTs, and the heart tests like ECG. BMI is the most commonly used variable which is derived from the mass and the height of a person with the formula weight in kilogram over height in meter square. Medical organizations tend to classify people as obese based upon their BMI. WHO classification of the weight status shows that if a person has a BMI of less than 18.5, it is underweight. 18.5 to 24.9 is considered in the normal range. 25 to 29 are considered overweight, and a BMI of greater than 30 is obesity. Obesity is further classified into the three categories. Class 1 has a BMI of 30 to 34.9. Class 2 has BMI of 35 to 39, and the Class 3 has BMI greater than 40. Although we are commonly using the BMI, the waist circumference tends us to give abdominal central obesity, but the body fat percentage provides us a more accurate assessment of individual's body composition. Body fat percentage chart shows that women essentially have 10 to 13% of the fat in their body, and the men have less fat. They have 2 to 5% of the fat. On average, if a woman have 25 to 31% of the fat and the men have 18 to 24. But if women have 32% or above body fat, they are considered to be obese, and the men, if they have 25 and above body fat, they are considered to be obese. It's the same WHO guideline showing that if a woman have 30 or more than fat percentage, then they are considered to be obese, and the male, if they have 25 or more fat, then they are considered to be obese. Obesity in children under the age of the 5 years are diagnosed to be overweight if they have weight for height greater than 2 standard deviation above WHO child growth standard median, and are considered to be obese if they have weight for height greater than 3 standard deviation above the WHO child growth standards median. Causes of obesity. Obesity is a multifactorial disease which has root in multiple and certain areas of the life. Certain health behaviors which can contribute towards the excess gain of the weight and are risk factors for obesity are lack of physical activity, unhealthy eating patterns such as eating too many highly processed foods, sugar drinks, little fiber, fruits, and the vegetables. Certain genetic predisposition can increase the individual risk of predisposing to obesity. Factors like availability of unhealthy food options, limited access to physical activity resources, socioeconomic status also plays a role. Not enough sleep or poor quality of the sleep, too much screen time, like too much TV, computer, and video game can also be a contributing factor. Epidemiological determinants of obesity. Obesity tend to increase with increasing age. Females are more prone to obesity, especially after their menopause. Genetical factors, sedentary lifestyle like low physical activity, illness, junk food, eating frequently sweets and refined food, endocrine disorder like Cushing syndrome, growth hormone deficiency, illiteracy, alcohol, depression, anxiety, frustration, loneliness, economic status, and drugs like corticosteroids, OCPs, insulin, and beta blockers. Health risks and consequences of obesity. Obesity poses a number of medical consequences, resulting in increased risk of the non-communicable disease, including coronary heart disease like dyslipidemias, diabetes, hypertension, chances of stroke, cataract. Certain cancers are more prevalent in obese population. It can result into a number of skin and joint problems like phlebitis, synostosis, gout, osteoarthritis. Gynecological abnormalities can also result in obese people like abnormal menses up to the extent of polycystic ovarian syndrome and infertility. It can result into the gallbladder disease and liver disease like non-alcoholic fatty liver disease, very prevalent in obese people, steatosis, steatohepatitis, cirrhosis, and certain pulmonary diseases like sleep apnea and hypoventilation syndrome. Double burden of malnutrition. It is a coexistence of overnutrition with undernutrition. Double burden of malnutrition is a condition which wasting, stunting, underweight, lack of minerals, and the vitamins is coexisting with obesity, overweight, heart disease, and diabetes in the same population at the same time. Lower middle income countries are specifically prone to the double burden of the malnutrition as the children in these countries are vulnerable to inadequate prenatal, infant, and the young child nutrition. At the same time, these children are now exposed to the high fat, high sugar, salt, energy dense, micronutrient poor food, which is tend to be lower in the cost, but also lower in the nutrient quality. These dietary patterns in conjugation with a lower level of the physical activity result in a sharp increase in childhood obesity, while undernutrition issue remains unsolved. Obesity prevalence and the trend. Global prevalence. Worldwide, the prevalence of obesity has nearly tripled since 1975, with over 650 million adults now classified as obese. Regional differences. Obesity varies slightly across different regions where one population may be affected more than the other, but overall, the obesity is on increasing trend, especially in the low and the middle income countries, posing a growing global public health coverage. This is the World Obesity Federation data, which shows obesity as a global issue, with 1.9 billion adults being overweight and 650 million living with obesity, which include 11% of the men and 15% of the women. WHO facts in 2022, 1 in 8 people in the world were living with the obesity. Worldwide, adult obesity has doubled since 1990 and adolescent has quadrupled. In 2022, 43% of adults which aged 18 years were overweight and 16% were living with the obesity. In 2022, 37 million children under the age of the 5 were overweight, and over 390 million children and adolescents aged 5 to 19 were overweight, including 160 million who were living with obesity. Obesity is also on the rising trend in Pakistan, up to the extent that Pakistan is now considered as the world's 9th most obese country of the world. According to WHO, 26% of the women and 19% of men in Pakistan are obese. National obesity risk is 6.5. Global Obesity Observatory show that obesity is on the rising trend in Pakistan, with the women more prone to obesity as compared to the men. Different articles and researches show obesity as an emerging epidemic in Pakistan, which affects all the age groups and widespread among adults, women and children, and women, men, and the children. The burden of obesity is higher among female in all the age group as compared to the male. Obesity in Pakistan, new epidemics show that it is highly prevalent in Pakistan. General population usually underestimate their body weight. Focus should be maintained on identify the risk factors from the early age and taking necessary steps like lifestyle modification to prevent them. With 1/5 of population, South Asia is facing a significant health problem in the form of obesity. The WHO report that 58.1% of Pakistanis are overweight, 43.9% are in the obese category, and it is also alarming that around 40% of children in Pakistan are overweight or obese. Obesity prevention strategies. Though obesity killing the world, it is highly preventable. Primary prevention include the lifestyle modification. The first thing to do is promote the healthy eating. We need to promote a balanced, nutrient-rich diet with a focus on the whole unprocessed food and educate the masses to stop eating crap, which include carbonated drinks, refined sugar, artificial foods, and the processed foods. This is the nutrition guideline of the daily amount, which shows that the men need to consume 25,000 calories, women 2,000 calories, and the children aged 5 to 10, 1800, girl 11 to 14, 1850, and the boy 11 to 14, 2200. How healthy adults should consume these calories. It is shown that the protein should be 10 to 25% of the total diet, carbs should be 45 to 65, and fat should consume 20 to 35% of the total diet. Carbohydrates provide us 4 calories per gram, protein provide 4 calories per gram, while the fats provide 9 calories per gram. WHO has updated its guidelines on total body fat, saturated and trans fat, and the carbs based upon the latest scientific evidence with the aim to reduce the risk of unhealthy gain of the weight and diet-related non-communicable diseases like type 2 diabetes, cardiovascular diseases, and certain type of the cancer. WHO recommends show that the fat consumed should be primarily unsaturated fats with no more than 10% of the total energy intake coming from the saturated fatty acid and no more than 1% of the total energy intake coming from the trans fatty acid, which is a strong recommendation. The different dietary approaches which can be used in obesity are the low-calorie diet, which result into the weight loss. Low-carb diet intake, emphasizing on the protein and the healthy fats, can be an effective approach for some individual. Mediterranean diet, which is focused on the fruits, vegetables, whole grains, and the healthy fats, has been shown to support the weight management along with the overall health. This is the WHO guidelines for healthy eating. We need to eat a variety of the nutritious food, which include fruits and vegetables, whole grains, fat-free or the low-fat milk and dairy product, lean meat, low-saturated fat, and need to stay within the daily requirement of the calories. We need to eliminate or reduce the foods which are rich in saturated fat, high-calorie drinks, high-calorie and the low-nutrient foods, avoid the fast food, and limit eating out. We need to address the environment and the family factors which is associated with the eating, like reducing the size of the portion, schedule the food consumption. Adults need to help children eat healthy and limiting the young children's screen time. Pakistan is also making policies, doing interventions and actions against the dietary habits. Pakistan country-specific first dietary guidelines were first developed in 2005, and since then, new scientific evidences are generated to review the food consumption pattern, nutrient intake, and nutrition and the health status of the population. Government of Pakistan, along with the Food and Agriculture Organization of the United Nations, has developed Pakistan dietary guidelines for the better nutrition. They have the goal to improve the nutritional well-being of the population, reduce the incidence of nutritional deficiency and chronic diseases in the population, improve the quality of the life of the population. Their objectives are to use the scientific evidence on the dietary patterns to promote the healthy dietary practices among the population, to promote the hygiene, safe food handling, proper food preparation, and the storage practices to reduce and control the food and the waterborne disease. They need to integrate the physical activity into the dietary intervention to achieve an effective and sustainable weight management program. Another lifestyle modification which is very important in management of obesity is physical activity. Incorporating physical activity into the daily routine, such as taking the stairs or going for a walk during the breaks, can also be beneficial. The strength training, incorporating resistance training exercise can help us build the muscle mass and boost the metabolism, contributing to the loss of the weight and management. Aerobic exercises, regular aerobic activities like brisk walking, jogging, or swimming can help us burn the calories and improve the cardiovascular health. Level of physical activity are muscle strength, bone strengthening, moderate exercise, and the vigorous exercise. WHO recommend that the children and adolescents should do at least an average of 60 minutes per day of the moderate to vigorous intensity, mostly aerobic and a physical activity across the week. It is also recommended that the vigorous intensity aerobic activities, as well as those the strengthening of the muscle and the bone, should be incorporated at least 3 days a week. Remember, doing some physical activity is always better than doing none. It is also recommended that the children and adolescents should limit the amount of the time spent being sedentary, particularly the amount of the recreational screen time. Global Action Plan on Physical Activity 2018 to 2030 is devised by World Health Organization with a vision: more active people for a healthier world. They are on a mission to ensure that all people have access to the safe and enabling environment and to diverse opportunities to be physically active in their daily life. They have a target to reduce a 15% relative reduction in the global prevalence of the physical inactivity in adults and in adolescents by the 2030. Secondary prevention. Secondary prevention basically involves overweight individuals who can use the information regarding methods to manage their weight and to decrease the risk of developing other chronic illness. That can include the weight management program by the clinic or the community, intense behavioral therapy for obesity, nutrition counseling, the pharmacotherapy, certain drugs like orlistat, peptide, topiramate can also be used, and eventually there is bariatric surgery, which is a method to achieve the significant and sustained weight loss. It can be gastric bypass, gastric binding, and sleeve gastrectomy. Tertiary prevention is basically the rehabilitation with the objective to help obese people achieve the healthy weight goal, promote adherence to the healthy lifestyle, teach them how to manage their diet by calculating the calories and limiting their disabilities. WHO initiatives to address the obesity epidemic. Global Action Plan. WHO has developed a comprehensive global action plan to promote the healthy diet and physical activity, aiming to halt the rise of obesity and related non-communicable diseases by 2025. Monitoring and surveillance. WHO tracks global obesity trends through its non-communicable disease risk factor collaboration, providing up-to-date data and analysis to guide the policymakers and inform intervention. Advocacy and the partnership. The WHO collaborates with the government, civil society, and the private sector to advocate for the policy changes and raise awareness about the importance of addressing the obesity epidemic. WHO understands obesity as a uprising epidemic, and for the awareness purposes, World Obesity Day is celebrated each year on March 4th. Now, time for the MCQs. Number 1, what BMI value indicate that a person is underweight? A BMI less than 18.5, 18.5 to 24.9, 25 to 29, 30 or 35, 35 or higher.
Alpha.
Yes, the right answer is alpha. Number 2, what is the primary factor which contribute towards obesity? Moderate physical activity, imbalanced diet and sedentary lifestyle, high intake of vitamins and minerals, genetic inheritance alone, more screen time.
B.
The correct answer is B. Number 3. Tara is a 45-year-old woman with a BMI of 32. She has recently been diagnosed with the type 2 diabetes. She leads a sedentary lifestyle and consumes a diet which is high in processed food. What would be the most appropriate initial intervention for her to manage her obesity and related health condition? We should start her on insulin therapy immediately, suggest weight loss medicine as a first option, recommend lifestyle changes including a healthier diet and increased physical activity, advise her to take supplements to boost the metabolism, refer her for the gastric bypass.
C.
C.
Yes, the correct answer is C. Number 4, which of the following is not a common health risk associated with the obesity? Type 2 diabetes, hypertension, dyslipidemia, nearsightedness, or cardiovascular disease?
D.
The correct answer is D. Fatma, a 16-year-old girl with a BMI of 31, she has recently been bullied at school due to her weight, leading to the low self-esteem and social withdrawal. She consumes fast food regularly and rarely engages in physical activity. What is the best approach to address her obesity and its psychological impact? Focus only on increasing the physical activity. B. Recommend a strict diet without considering her emotional well-being. C. Develop a comprehensive plan which includes counseling, nutritional education, and physical activity. D. Suggest skipping meals to lose the weight quickly. E. Prepare for her weight loss surgery.
C.
C.
Yes, the correct answer. Yes. Ali is a 35-year-old man who works long hours at a desk job. He has gained significant weight over the last few years and his BMI is now 33. He experiences fatigue, SOB, and occasional chest pain. His doctor has warned him about the risk of the cardiovascular disease. What should be Ali's primary focus to reduce his risk of obesity-related cardiovascular disease? A. Increase his intake of sugary drinks for more energy. B. Engage in the regular physical activity and adopt a heart-healthy diet. C. Take painkillers to manage the chest pain. D. Ignore the symptoms and continue with his current lifestyle. E. Start skipping meals to lose the weight.
B.
The correct answer is B. For which of the following health condition a high BMI considered as a risk factor? Arthritis, asthma, hepatitis, type 2 diabetes, nearsightedness.
E.
D is the correct answer.
Sorry.
Amna, a 29-year-old teacher with a BMI of 27.5, has been experiencing knee pain. She enjoys jogging, but she noticed that her knee pain worsens after running. She is worried that her weight might be a contributing factor to the problem. What advice would be the most appropriate for her? Incorporate low-impact exercise and focus on the gradual weight loss. Stop all the physical activity to avoid further knee pain. Continue jogging without any modification. Start crash diet for the weight loss. Increase running intensity to push through the pain.
A.
Yes, the correct answer is A. Which of the following is the most common surgical treatment for the obesity? A. Appendectomy, stenectomy, liposuction, gastric bypass, gallbladder removal.
B.
The correct answer is B.
B.
Gastric bypass. What is the recommended daily intake of total fat for an average adult according to dietary guidelines? 10 to 20% of total daily calories, 20 to 30, 35%, 35 to 50, 50 to 65, or greater than 70%.
B.
Yes, correct answer is
B.
20 to 35% of total daily calorie requirement. This is the key to the MCQs. Thank you.
Assalamu alaikum. Dr. Shajeea present the topic quite well and in elaborated way. All the components related to obesity are covered, and all recent guidelines related to obesity covered comprehensively. And in the MCQ part, the MCQ number 4, 7, and 9 are not scenario based. These three MCQs are in one-line statements. So please change these MCQs and then send the presentation in the PG group. Thank you.
Sure, ma'am. Thank you.
Very well, Dr. Shajeea. I would like to add some things like there are many new advances in obesity management, like the Barrett surgery or the liposuction, and other medicines are being used in recent practice, like the somatostatin analogs and GLP-1 analogs. It would be better if you incorporate these new recent advances in your presentation. Otherwise, it is well presented.
Sure, sir.